Welcome back to my YouTube channel, Patricia Monna, Intuitive Consulting. Today I have a very special guest with me. It is my honor to introduce you to Dr. Leonard Knell, who is a retired orthopedic surgeon with over 50 years in the field of medicine. He is also the creator of the LifeShield Laser, and I'm all about frequencies. So Dr. Knell, thank you so much for joining me here today with your wonderful, wonderful laser.
You're treating me when you do that.
Oh, I know. And anybody who's watching it, that's the crazy thing is that I use this in my online healing, and I'll blast them, at the camera like that. And I also use it all the time in my meditation classes where when I'm leading the meditation, I actually will go around and use the laser to realign their energy and give them that boost.
Do you have
So,
a pet, Patricia? Do you have a pet,
yes, I have two little Pomeranians. Yes.
Pomeranians? Have you used it on them?
No, I haven't.
Yeah,
I
use it
haven't.
on all their food and water. Where's Theo? Theo, come here, baby. Come here. Come here. Come here, Theo. Come here, sweetheart.
Oh,
Theo, come here.
probably knows
This
that
is,
you're online.
come here. Come here. Come here. Come here. Here. Can you see him?
Oh, what a sweetheart.
Yeah. He probably is the only dog in the world that has been raised on that laser. And the interesting thing about him, I've told people that the laser itself, if you understand how that works, it actually raises the consciousness of the individual because you got to think outside the box. This
Yes.
guy is the only one, probably the only dog in the world that's ever been raised since I got him at 7 weeks. And he exudes the frequencies of that laser. And it's hard to believe, but if you test, you know how to do the balance test?
Yes.
Okay. If I test someone as far as their balance is concerned, I mean, everyone tests, negative. They can't maintain balance. If you pet him for about 20 seconds, they're in balance. He's actually transferring the frequency of balance to them. It's amazing. I've tested hundreds of patients or hundreds of people. Anyway,
Well, you know what? That makes a lot of sense to me because we absorb what we're around, right?
exactly.
We
Yeah.
start to emanate the same energy of what is around us. So, and I actually use this to even charge all of my stones, um,
Yeah.
my rings, my diamonds, because you know why they say diamonds are forever? Because it holds the imprint forever.
It holds the imprint. That's right.
Yes, it does.
I
So,
don't know. It holds it for a while. Okay. Uh, if it's imprinted scalar wise, and there is scalar energy in that laser, it will. Uh,
well, I want
I
you to explain it. Explain what you've created here so people know how
well,
amazing it is.
the new laser has it's a 405 nanometer blue light lasers. It's in the ultraviolet range, and it has there's over 4,000 frequencies in that little laser, and they're all for health. There are no negative frequencies. They're
Mhm.
all positive. In the right frequencies, which you're familiar with, Patricia, the right frequencies, most of the right frequencies are really not right frequencies. Rife only created the ones that he found through his microscope, and those were phenomenal for dealing with organisms like viruses and bacteria. But they actually were used to destroy bacteria and viruses. This tends to put the body into balance. I don't know if did you ever watch that video? I think I sent it to you. I sent it to you. The video where I say it's not snake oil.
I don't know. Maybe I did, but I can't remember. You
Well,
send me a lot of videos, and I usually watch them.
I sent this recently. I sent it in one of the last emails I sent to you. It's about a 7 or 8 minute video, and in it I talk about balance because homeostasis is what health is really all about. It's a matter of keeping balance, and whatever you can do to keep balance, which starts really with the way you think, with what you eat, exercise, and so forth. This enables the body to maintain balance. It's very simple. The genius is in the body, not in the instrument. The instrument is just providing you frequencies. And as you know, I don't know if everybody knows, but everything is frequency. Everything is based on frequency. Yeah.
Everything is energy. It is.
Everything is energy. So
So
what we see in our world is not really what we see is really sort of there's a trick being, imposed upon us, because what we see in our vision is really seen inside of our head. And
yes.
we're really seeing nothing more than frequencies which are interpreted by our mind. So we're nothing more than, if we could see at a certain level, it's energy moving at tremendous speeds, and everything is like that. So theoretically, we should be able to do things that you would think would be miraculous, and I think someday probably we will be able to do those things.
Well, I think I think our ancient ancestors absolutely knew how to do those things, and
Yes, I agree with you.
we've been dumbed down
Yeah,
through the centuries, but I definitely think that it's within all of us. Look at astral traveling and remote
exactly.
viewing, and even with me finding missing people,
Yeah.
using nothing but my intuition. It still blows me away that I'm
Well,
capable of
you're
doing.
you're connected to the field. You're really connected to the field, and if you really think about it, we all are connected to the field. When they talk about oneness, we're all one, and we're all connected to the field. Let me turn off this. You get more spam calls. If you get them up in Canada, we get them down here all the time. Yeah. Anyway, we're all connected, and you do that. I mean, that's an amazing ability, which I would love to be able to do. But it's like anything else. Certain people are better at things than others. That's not everyone can pitch a no-hitter. Not everyone can be a superstar in sports, but
Well, and not everybody can be an orthopedic surgeon too.
well, actually, if you,
That's
yeah,
a superpower in itself.
that's easier. That's easier. That's a matter of that's studying. That's a matter of just spitting back what's in the books and learning how to do the carpentry work that we do in orthopedics.
You know what, though? Funny enough, I have a little orthopedic surgeon story for you. So when I was younger, I broke my arms all the times. Like I broke my arms 12 times altogether growing up.
That's
And
hard to believe. That's hard to believe.
I know, I have very weak, brittle bones, teeth. Yeah, I'm brittle. I break.
Yeah.
And there was an orthopedic surgeon by the name of Dr. Changer, was his name. And I just remember looking up to him like he was God, putting my bones back together. And what was so interesting was his assistant who did all the casts at the cast clinic.
Right.
I was in there so much that, they knew me by name. It was very familiar. We were on really, close terms. I was in there all the time. And, fast forward 25 years later, it was this same casting assistant that was then putting a cast on my son's arm when
Yeah.
he broke his arm. And so it's definitely a talent, what you guys do. Absolutely. And I think it's a calling. But for you to be able to put bones back together and do
We
that,
put them.
that's fascinating.
We put them back together, but God heals. God
Yeah.
heals. We have a lot of leeway because it's amazing. On a child, you can put bones together like this, not like this. I don't know if you can see this. You
Yeah.
can put it like this, and that's the way you should put them because they overgrow, and they'll heal beautifully. They heal beautifully. It's
Well,
the healing response is, yeah. What's that?
I gotta show you. I have Jesus band-aids
Okay,
because Jesus heals.
that's right.
So I love that you said that. I love that you said that.
Well, it's true. It's actually true. There's I use a lot of techniques that throughout the years. I mean, I had a very interesting orthopedic practice because I did all what every orthopedic did, and it was sort of a cutting edge practice because we incorporated a lot of things that weren't utilized in a conventional practice. I could get away with it because I did things like total hips and total knees, and I did a lot of them. And so when I did certain things that were not really, mainstream in the mainstream medicine, I got away with it. Our entire hospital was set up with for giving castor oil packs to our patients, and nobody knew where they came from. You know where the castor opening came from. I'm sure you do. Yeah,
Yeah,
Edgar Cayce. Edgar Cayce.
totally Edgar Casey.
Edgar Cayce. Yeah, and I was a student. I was a student of his since I was a teenager. I read every book on him by the time I probably was 15, 16 years of age. So I knew about him before I started medical school. And
That's
that's one of the he's one of the reasons why my practice developed the way it did. But you know, we really did a lot of things that were very interesting. I used to hypnotize patients, like if you would come in as a young kid
yeah.
with a broken bone, a both bone fracture of the forearm.
Hmm.
That requires really putting the child to sleep or under some type of minimal anesthesia.
Yes.
And many times you couldn't get the operating room because it was tied up with an emergency. So instead of having the patient stay in the, ER or admit them, I put an IV in and give them a little bit of Valium to put them in a twilight zone,
Yeah.
and then go from there with hypnosis, and then set the arm and send them home. And it was beautiful. And the kids were always happy to see me when they came back, and I was happy to see it was a wonderful technique. And
Amazing. God, I wish the doctors nowadays would take your lead. I really do. I think that we're missing that connection, within our medical field. As you know, I was a nurse for 13 years, and when I walked out away from that career, I'm best thing I ever did, really. I miss helping people in that capacity, but I don't miss the politics that went with it.
no, I agree with you. In fact, I can't stand what's going on, as you know from what I send you, what's going on in medicine today. In orthopedics, we put people back together. That's why I think I went into it. We don't take, it's like a general surgeon cuts out things. We don't cut out anything, and except the tumor if it happens to occur, and they're very rare in orthopedics. But we put people back together. They come in banged up, we put them back together, and we're happy and they're happy. So it's a very, very happy field. It's a good profession.
Wow. You're a human angel. I mean that.
No, 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 no. That the thing I miss in medicine is not the surgery or anything. It's the contact with the people,
Yeah.
because that's the thing that where you really get the satisfaction. And you saw that too and you don't have that today. You don't have that. We've sterilized medicine to the point where the nurses do nothing more than chart. When
Hmm.
I first started, the nurses gave back rubs. They watched the skin. You didn't see any decubitus ulcers. That's hard to do right now. There's just too much documentation that has to be done. And
Yeah.
the doctors have to see patients, numbers. And I couldn't practice. I'd be a dinosaur today practicing.
Wow. Yeah, no, it's either pushing pills or paperwork.
That's exactly right. And pills are, I mean, I've never had a negative side effect from this laser. Never.
Yeah.
And when the FDA was interrogating me before I put it on the market, I mean, they thought this was a medical device. And I don't know if you've ever gone over the website carefully, but initially I wrote this out in medical terms and with cases, etc. And when the FDA looked at it, they said this is a medical device. You have to go through all these different tests before you can put it on the market. And I already had videos uploaded to YouTube, etc. He says you got to take those down. I mean, unbelievable, unbelievable. And I didn't do any of that. They checked the laser out, and the laser is exactly what I said it was.
Yeah.
But they said you still have to, get it cleared through the FDA because of the frequencies in it. And all we're doing is treating water. I'm treating the water in the body. That's all we're doing. Okay, the body's doing the rest. So I said, well, what jurisdiction do you have over plants? And they said, none. I says, and what about animals? Well, they said the laser. I said, you've already cleared the laser. So they had nothing over it. I said, I'm selling this to plants and animals. And in my website, I say it works on all organic things. And the people picked up on it. Yep.
Ah, that's smart because even up here in Canada, they're really going after all of the natural medicines.
They don't
Any
want the
sort of vitamins, it's war. It's all at war. Like he's trying to ban them right now.
Yeah, that's the same thing was occurring here in the States. I mean, I used to vitamin C. I use probably more vitamin C probably than any doctor in the country. I mean, our all of my patients post-operatively receive vitamin C, 12,000 milligrams, 12 grams. I gave it IV. It stops the side effects from the anesthesia. It also helps with wound healing. And I've had so much experience with it. And when I first started in practice, shortly after, Linus Pauling, the two-time Nobel Prize winner, had an article in the JAMA, the Journal of American Medical Association, which I didn't stay in for very long. I think I was a member for maybe a year. But, he was touting vitamin C and the benefits. And everyone said, he's an idiot. Well, he was a two-time Nobel Prize winner. I read everything that he wrote, and actually checked into there was a general practitioner down in North Carolina who he actually got most of his information from. Mm-hmm. And this is something that people should know because I've had a lot of experience with this. It ups the immune system tremendously, but you've got to take it in not the doses that are recommended. The recommended dose for vitamin C is 75 milligrams a day.
Oh, wow.
Linus Pauling said you need to take 4,000 milligrams a day just for maintenance. And the way he established that was by doing studies on animals. Most animals, mammals, make their own vitamin C. We don't.
Interesting.
So he took the surface area of a mammal and calculated what we would need, okay, if for the same thing in the course of a day, and it came out to roughly 4 grams. So if you took 4 grams a day, that was maintenance for you. But if you had an infection, you took much more. You took it up to tolerance. And they don't. I said when COVID came out, if we would treat with IV vitamin C in 50,000 milligrams to 100,000 milligrams per day, it would knock it out within 24 to 48 hours.
Wow.
And I believe that. In fact, I had a friend came to me and said he had 2 friends in Wisconsin who were very sick, the mother and a daughter. One was, I think the mother was 80 years old. The daughter was something like 60.
Yeah.
And I think they were both nuns and very sick from COVID. And I have a whole regimen that I told people to start doing, but it was too late. I says, get in as much vitamin C as you can. I think I have 4 or 5 thank you notes from them. Completely stopped it. But you got to take it in, like at least 20, 30, 40,000 milligrams, which is, they come in 1,000 milligrams capsules. So you got to take 40 a day. That's a lot. You have to saturate your tissue.
Wow.
Yeah.
Wow. Well, it's really good to know. I'm glad that we're talking about that.
Yeah.
Because we are going into the season where they're starting to threaten people again with mandates and restrictions and, and saying that there's a new variant coming out.
It means nothing. It means nothing.
I know, especially for the people who have not taken.
People cannot succumb to fear. That's what they want. Fear. This was it was a pandemic of fear.
Yes.
Of fear. And the people who, if you saw someone in the newspaper saying something, contrary to the narrative, they were speaking the truth. Yeah. What you got in the papers or on the news, the mainstream media, was absolutely lies. And the people who spoke up they lost their licenses.
Yeah. Well,
I've never seen it. Yeah.
Even with YouTube and Facebook and Instagram and all that, the censorship is it's crazy, but it's because they don't want any other narrative out there than theirs. They don't want their narrative challenged, but yet the truth is coming out because there was good doctors at the beginning who did say it would take between 2 to 5 years to actually see the effects of what was given to them, right? And it's coming out. It's coming out. Look at the side effects that this thing has caused and permanent damages that this thing has caused. Like in Canada, for the first time ever, they made a vaccine injury support program. So if there is anybody who's watching this that was injured from taking it, please, please, please report it. Report it not only to your doctor, but report it to the Canadian Vaccine Support Injury Program, because they need to know. They need to know what they've done, what they've created. And from what I understand, the more that you've had, the more it's going to wipe out the immune system. So the common cold will feel very much amplified. Well, they're also saying that this new variant that is coming out is going to be a doozy. But from my understanding, it's a doozy for the people who took the mRNA
You're right.
vaccines, because that's the one that's really messing with the immune system. And for anyone who is interested in what I'm about to say about the immune system, being kind of wiped out, you need to look up IgG4,
Right.
and then just look up IgG4 COVID vaccines. That's all you got to Google. And the NIH has dropped a big bomb saying that, oh, this was something that no scientist could have predicted. But the more of them that you have, it's actually causing very bad permanent damage. So look up IgG4 COVID vaccines. I'm probably already saying the trigger words that's going to get this flagged, but we will see. We'll see.
Yeah, well, there was a scientist who was mainstream in the vaccine industry and came out and said exactly that before. He said you can't come out with a vaccine in the midst of he called it the pandemic. Mm-hmm. And he's absolutely right. And if you look at the numbers, we have VAERS. You're familiar with VAERS in the United States?
Yes, I've heard of it. Yes.
Okay. It's the vaccine accident registry for the CDC. Now, if you would look at VAERS, I think in 2008 H1N1, they had less than 25 deaths. They pulled it from the market. If you look at VAERS, and no one goes to look at the statistics, but there were roughly 25,000 deaths related to the vaccine itself in the first year. And they know that roughly at the most, okay, only 1% of the people report to VAERS. Yes. So it could be 100 times that.
Yeah.
I mean, it was just,
well,
the thing is, they didn't want anyone to come out and say there were other treatments because they couldn't get an emergency authorization.
Yes, you hit the nail on the head. If there was any sort of solution, they wouldn't be able to push through their product.
Yeah, and here, I don't know, ivermectin. If you talked about ivermectin, that was horse dewormer. Even on the CDC site, they say, come on, that's a horse dewormer. But if you look at the links, the links on ivermectin, and it goes to the studies on the CDC site where they're telling you can't take it, the links are telling you it's effective. It's effective. And Fauci knew this. He knew this. He knew it about hydroxychloroquine. Hydroxychloroquine in the States, if someone wrote the prescription, the pharmacist wouldn't fill it.
Yeah.
And the interesting, I don't know if you know this or not, but in the medical, this is something I've never seen before in my entire time in practice. In the medical field, peer-reviewed journals are very difficult to get articles into. Okay. There was an article that came out about hydroxychloroquine, and it was published in The Lancet, which is a British journal, very, very, very good journal, and the New England Journal of Medicine, which is a very good journal in the States. And it was the largest study ever done on hydroxychloroquine. It had over 10,000 people in it. And it said there were cardiac irregularities and this and that and so forth. You can't take it. And it was spread all over the paper. When I told some people, we were at a gathering together, that hydroxychloroquine is effective, and I had done the study myself, looking in nations that were using it, they said no. They quoted the study on the study I'm relating to now. About a month later, it came out this was a fraud. The study was a complete fraud. Now, how do you get in two excellent peer-reviewed journals a study that's a complete fraud to tell you not to take something that's effective, effective against COVID?
Absolutely.
Do you know what do you have any idea what the overall death rate of COVID was?
What?
You know, I had someone over my house, happened to be a principal of a grade school in town, and she and her husband were here. And this was in the sort of after the midpoint of the COVID. I says, what do you think the overall death rate, taking all ages, okay? And that means people, you know, young people, old people, my age, okay? She said 25%, and her husband said 20%. It's 0.236%. It's less than a quarter of a percent. Fear, that's what did it.
Yeah, I agree.
And that's what the people, above all, you can't be afraid. And they said nothing. They said nothing about building up your immune system by taking vitamin C.
That
Or
should have been the first thing that people noticed. Like, why weren't they promoting healthy lifestyles at all?
absolutely, and vitamin D.
Yeah.
Fauci, Fauci, not once spoke about, and he had a worldwide podium. Take vitamin D. People on intensive care units who were, and these were the sick patients, if they had adequate vitamin D levels, 75% of them survived. It was just the opposite if their vitamin D levels were low. All you had to do was have them take adequate vitamin D. That's all. And that's over the counter and it's cheap. Wasn't put on. You're a disinformation purveyor if that's the case. You know, it's terrible. People have to wake up.
Oh, they do. They do. Well, and here's the other thing. Honestly, when have the governments been on the right side of history? That's what kept going over and over in my head was when have they been on the right side of history when we look backwards, right? And
You're right.
so for me, it didn't feel right. It did not feel right. And I'm so glad that I didn't fall for their scam.
Sure.
I'm scared that, well, I'm not scared. I have no fear about this, none. And I believe that people like you and I were born for this time so that we can stand up and go, hey guys, something's not right about this, and you need to listen to your gut, you
You know,
know?
the problem, Patricia, is if I was practicing right now, they would take my
Yeah,
license.
they
I
would.
spoke up like this. They had at the hospital where I practiced before they had the vaccine available. They called me. I had a message on my answer machine saying that they were holding a vaccine for me. This is before it came out. I mean, and I never took it. I never took it. I wouldn't take it.
Good, good. Yeah, there's no way for me either. Just no way. But I mean, how are they already coming out with something new for this new variant? You
They're
know,
going to keep. They're going to
just
keep coming at you with variants. It's
yes,
like
they are.
the flu is a coronavirus, and they can't really. For years, they've been trying to come out with an adequate flu vaccine. They never have. They never have. You take the flu vaccine?
No, no,
No.
no, no. I did my first year of nursing. They forced us to. They force all the nurses to every year. But I got so sick within 48 hours that it landed me in the hospital. And so, yeah, no,
I'm
I've
not laughing at you. I'm laughing because I had the same experience. In medical school, we had a lecture by the individual who had developed the injection gun. He used to go down to South America and vaccinate an entire village, you know, in no
wow.
time at all.
Yeah,
So at the end of our lecture, we had 80 individuals in my medical school class. They vaccinated all of us for the flu as we walked out the door. Okay. And I came down with the flu. I've
yeah,
never taken a flu vaccine since, and I've never had the flu. I've never had it.
that's amazing. Yeah, I've had it a couple times in my life, but you know what? Dr. Nell, I have not been sick since long before this pandemic. Like 2000, 2011, I think, was the last time I was really, really sick. And so basically, since I've been doing this work, I've been, knock on wood, I've been excellent, excellent. No flu, no cold, no cough, no nothing. So it's
You're,
it's
intuitively doing the right things. Your thinking is right. Okay.
thank you.
You're yeah, you're
Well, you
I
know
don't
what
know what
I do?
the diet is, but I'm sure it's good.
Well, you know what
Yeah.
I do on well, I try to do it on a daily basis, when I remember. But what I do is I'll do deep breathing and visualizing that breath turning into golden energy, and I'll fill my body with it. And I'll do that deep breathing until I start to feel that fuzzy tingling sensation inside of my body. And I visualize that as a protective liquid gold filling every single cell in my body. And then I imagine the skin, the pores on my skin opening and breathing that golden light out through my skin and into my auric field. And I imagine that becoming literally my light shield, where nothing can get through it. And what's interesting, if people may think, oh, well, that's just your imagination. No, it's worked. It's worked. I haven't been sick. And you got to remember, germs and viruses and everything, they start from out here. They have to go through your auric field in order to have access to your body, right?
You
So if you're burning it up in your field, there's nothing that's getting close enough to enter me. That's the way I look at it.
know, you're right on. If Edgar Casey said, and it's one of the things that actually I took away, probably the most important thing I took away from all of his readings. He said, thoughts are things. Thoughts are things. So thought is an absolute. So in your mind, I believe that the mind works on scalar energy. So when you imagine something, okay, how do we create anyway? We're creating from this field, the field of infinite possibilities. Our mind is actually, we're the co-creators in this universe, and our mind is actually taking this energy and putting it to use. We're creating what happens in our environment. We're creating a lot of things, but we actually start with our bodies. And what you're doing actually makes a lot of sense to me.
Thank you. Thanks. Well, yeah, we're mind, body, soul. So why not treat it on all three levels, right?
Right. Yeah.
So how does this work on the field of energy
Okay.
versus the body versus water?
Okay. Water has an infinite amount of ability to memorize. Water has memory. You're familiar with Masaru Emoto's work?
Yes, yes,
Okay.
programming water
Okay. How did he program it?
through thought and intention.
Thought and intention. Okay. So what he did, he was putting a thought, and he did the experiment where he took 2 glasses of water, okay, and on one he wrote, I love you. And on the other one, he wrote, I hate you. And then he flash froze it the following day after 24 hours. And what happened? On the one he wrote, I love you, there was a beautiful, beautiful crystal, six-pointed crystal, which is sacred geometry. And on the other one, it was distorted. It was, just a mess.
Mm-hmm.
So he was actually using the thought. Now, what is your body made of?
Water.
75% of your body is water.
Yeah.
Okay. 75% of the earth is water. And what's on the ground portion, a large part of that is water.
Yes.
So water is the most interesting substance and the most valuable substance that we have here on earth for life. Okay.
Yes.
Now, you mentioned you have an auric field around you. That's your energy field.
Yes.
You think that we take in things through our auric field?
Yes.
Okay.
Absolutely. We
That
do.
laser beam takes in the laser beam itself. You can think of as a railroad train, okay, with passengers. Each passenger is a frequency. So I'm taking 4,000 frequencies and I'm interacting with your field, the biofield, which is around you, auric field, biofield, call it what you want. And that immediately connects with the entirety of you. So if you take something, okay, like the first, I wanted to know, when I first developed this, I wanted to know how long would the balance work. So I took a young kid in Mexico. I was vacationing in Mexico.
Mm-hmm.
And I gave him one little tiny sip of water. And I tested him. I was there for a month. And I tested him every day for a month. And when I left at the end of 4 weeks, his balance was still perfect. So that little bit affected his. Now I did that. If you look on my website, you'll see I did that. It was very interesting. While I was down there, I thought, what would happen if I lasered an entire pool? So I did an experiment with 2 people who I actually was an elderly lady, not elderly to my age now, but she was about 80 80 years old, and she had her son-in-law there and her daughter-in-law, or her son rather, and the daughter-in-law, and they had not been exposed to the laser. So what I did is I said, would you mind doing an experiment with me? And I tested their balance, which was terrible, as it is on everybody. And I said, now, would you mind soaking in the pool for about 4 to 5 minutes? And I had previously lasered the pool for about 30 seconds, okay? Just like I would laser a glass of water.
Yeah, so not for very long.
Yeah, 20, 30 seconds. They went in the pool, came out. I tested their balance. It was fine. Now, the interesting thing was, as I was walking back to my condo, I ran into one of the fellows who worked there. And I had, at that time, probably treated everybody there. They all wanted to be balanced. And he stood up with his leg up in the air and put his arm out so I could, put the pressure on the seat. And his balance, and the people he was talking to, their eyes opened up and they said, what are you doing? And I says, here, I'll show you. So I went to test them and their balance was perfect.
Wow.
And I said, have you been in the pool? They say, yeah, we just got out. Everybody in the pool was balanced. And they didn't know, they didn't realize what their balance would have been. So there was a lady sitting in her dress on the lounge by the pool. I said, you haven't been in the pool. So I had her stand up and I tested her. And of course, she was out of balance. And I balanced her. But we subsequently did that. And I have it on my website. It's on the second page where we did young kids, middle age and old. And it shows the before and after. But the entire pool. Now, the question I have is, after I did this, by the way, in Mexico, I got up and I went down to the ocean.
Yeah, I was just thinking that because I'm heading to Mexico in November and I'm thinking, oh, I'm taking this with me to the pool. And then I thought, well, let's go to the ocean with it. Oh, I love that we're on the same way.
And I was there with my cousin. He says, where are you going? I said, I'm going to laser the ocean.
Yeah.
He says, you lost. He says, you're out of your mind. Now, I think if you would see the images of plants, what happens with plants? I don't know if you've treated plants or anything with this.
I have tried it. Yes. When one of my plants was dying, I did. And I also did the water. Before I watered it, I made sure to laser the water and then water it with lasered water. And I did do the soil around the plant as well. And the plant is thriving. Thank God, because it was a beautiful little jade tree.
Yeah, I've only used it on water, and I did an experiment initially. It's on my website with roses. I took 2 identical roses, and I lasered tap water.
Yeah.
For one, and didn't for the other. And if you look at them, the one is still looking like a beautiful rose. The other one's all withered up with the leaves and dying.
Wow.
I did that. I should send it to you. I did that with a fig tree that my neighbor had planted down the street from me. And when we're walking in the morning, he loves my dog, and he always goes over there and has a treat for him. And we sat down. This was a year ago, and he says, I'm going to dig up that fig tree. It's been in for a year, and it hasn't. It was a stick. So I went over and I looked at it, and it was brittle. It looked to me like it was dead. He says, would your laser help? I says, I don't think so, because it looks like it's dead. He says, well, it can't hurt, can it? Which it can't. I says, no. So he got a bucket of water. I lasered the bucket. He poured it on the fig tree, and you should see it now.
Wow.
Within I think 8 days, there was new growth coming up from the bottom. And that was in, I think it was June 1st. By August 1st, in 2 months, there was a tree that was about 3.5, 4 feet tall. It was amazing.
That's amazing. Well, I saw it with my own eyes because the type of plant or tree that I have, it's like it's got these little tubes as leaves. It's the weirdest thing. I'm pretty sure it's called a jade tree, or it's a money tree. My husband bought it for me. And it was all shriveling right up. And when I started using the laser on it, that's when I noticed them becoming full and plump again, and then new growth and stuff. So yes, it definitely works on plants. For sure.
All you have to do is just do the water. You don't have to laser the. In fact, I really haven't lasered the plants. I have a lady who bought it in Austria. Bought the laser when it first came out. I met her on a Greek island cruise, and it's an interesting story. But she has a farm, and she puts everything up from seed, and all she treated was the seeds while they were germinating. And she says every one of them took. That's never happened before. And she says the plants look like bushes. And she sent me a picture of one, which I have. It's amazing. I mean, with plants, they just thrives.
Well, even when I do this on my hand, I can feel it. I
Yeah.
can
So
really feel the
well,
laser.
you're sensitive to energy. I
You
can
can't
too.
feel it when you do that?
No, I do. I can.
Oh, okay. Yeah, because
I,
I can feel it. I can
yeah.
feel it.
But
Maybe
many people cannot. I don't know if you can see this or not. I had a lady bought a laser. I happened to be at a show, and yeah, here it is. I don't know if you can see that or not. Can you see that?
Oh, yes. Yep, yep. I can see that. It's looking pretty dead.
Pretty dead. Okay.
Yeah.
She lasered the water, and this is a picture 4 hours later.
No way. Wow.
Yeah.
That's
4 hours later.
amazing.
4 hours.
4 hours.
Yeah. Somewhere I've got the fig tree in here too. I don't know where. I've got so many pictures. I don't even put them up on the site anymore.
Yeah. So
Anyway,
they're all beneficial frequencies that are programmed into this little tiny laser.
yeah, they're all beneficial. There's nothing that can harm you. I've never had a negative. I think yours is still on.
Yeah, it is. I've been doing my hands the whole time. I'm like, well,
Uh,
I'm here
if
with
you,
it. I might as
if you
well.
have a trigger, if you have a trigger finger, that's the way to treat a trigger finger. Just treat
Ah,
the finger. You won't need surgery.
too funny. Yeah, no, it's yeah, it works. It works for me. I love
Yeah,
this little thing. I love it. I usually have it in my purse or in my desk at work because it's used quite a bit in my studio on my clients and stuff.
yeah.
So I
I,
like
I, I just had someone send me a testimonial on an individual who had 5 foot surgeries. In fact, wait, maybe I can find it for you.
I love testimonials.
Yeah,
Oh,
I didn't even put them up. Oh,
you
here.
should. You should. Because the laser is amazing. And you're gonna have to share how you got into this, how you made it.
Okay, let me see if I can find this because it's an amazing. There are two. I want you to try, by the way, the remote healing that we talked about. If you can see if you can work with someone, I like to because you understand it, uh,
Yes,
and most people do not.
through quantum healing.
Yes, I should have pulled this up before, but I.
Oh, no worries. Wish this thing was around when you were a doctor, hey? When you were still a
I would be using on every patient, but most doctors don't understand it. I've
yeah.
got a nephew, in fact, who's he's a good orthopedic surgeon, but he just doesn't understand the laser. He doesn't understand it.
Well,
It's
it's just like with Rife therapy. You know,
no,
I had no understanding of it until I didn't even know it existed. And a lot of people have no idea that Rife therapy exists, right? And so for me, it was quite the shock. I ended up buying a holistic wellness center that was 7 years old, 7 years in business, turnkey business. And the Rife machine was already there when I bought it. So for me, I ended up buying my cure because I was 210 pounds walking with a cane when I bought that shop. I
yeah,
was in a lot of pain. And if it wasn't for Right Therapy, I don't know where I'd be right now because it certainly gave me my life back. And that's all frequencies. So
all
when
frequent.
I started talking about your laser and having, 4,000 healing frequencies in it in one stream, that blew my mind. I really wish this technology was more mainstream, that more people knew about it.
I have done nothing. I've never really hired a salesman. I've never because when I got in the argument with the people from the FDA,
Hmm.
I was supposed to take down every video that we had already done and so forth. That was all up before we even put it on the market. And
Yeah.
I've never advertised. I've never done anything. I have some people have sold it, but I never met them. They called me and heard about it. And they wanted to sell it. And I've got a fellow right now that he sells them under his own. He puts his own sticker on it.
Yeah.
But he puts a lot of money going into shows. And in fact, I told him about healing remotely, And I'll read you that. Did I tell you that testimony? Did I show that to you? I don't know.
You might have, but hey, everybody else hasn't heard it.
Yeah, it's really something, because I told him that I thought I had done the testing balance just with a neighbor, and then I went over and tested the water on someone who had not been exposed to it, and the water balanced them, and the only way it was treated was through my phone using a video call. So I
Ah,
told him,
that's right.
yeah. So I told this fellow about it.
Yeah. Sorry, go on.
Okay. And here's the guy's name is Gary, who owns the business, and he goes into these big shows, and he invests a lot of money selling it. He also gets a lot of money for what he sells it for, much more than I have it on my website. Hey, Gary, again and foremost, thank you for relieving my severe body trauma for the first time in years. I'm very much a skeptic, but my mom, who lives in Scottsdale, Arizona, did a treatment with me through her phone. He's got that in caps. And it worked amazingly. I live in Boise, Idaho. So how can this be? I'm grateful, astounded, shocked, and so happy to be pain-free for once. Again, I'm a first responder with severe body trauma, 4 gunshot wounds, a severe AC joint separation in my left shoulder, many major orthopedic surgeries on my left side, severe traumatic brain injury, plantar fasciitis in my left foot, etc. After my mother did the treatments on me through the phone, I am quietly pain-free tonight, relaxed, and in a very happy place right now because of your product. Foreverly, gratefully, your friend. And I said, I responded, I said, thanks, Gary. I knew it would work. That's a payment that money can't buy. And
Aw, it's amazing.
he sent me this one. I just got this one on a person. Part of it was cut off, but it says swelling is decreased, but the pain is so incredibly diminished in just a week. I'm amazed, to say the least. One question: can this be taken on an airplane? I don't want to get to the airport and be told I have to leave it behind. This little device is giving me my life. And he put on here, using the laser after 5 foot operations.
Wow.
That's the kind of things. I think in it may have an effect also. The practitioner may be amplifying it, like a mother working on her son. Okay, you're going to get that unconscious, invisible force that we're not really aware of working. You're getting it when you use it, and that's something you have to study. But I know it works with balance, and there's nothing that that's just a non-committal. There's no energy put into that. But I just had the feeling it would work. It would work through the field, because we're all connected, and you're connected. This phone actually is using photons. Okay, and that's really what's interacting with you around your biofield. So we're just having an intermediary. So theoretically, you could treat someone all the way around the world.
Oh, yeah.
Yeah.
Well, I'm thinking, if we could treat the ocean,
Yeah.
and
The question I have.
manually there. But I know that we can treat people online like this because I've done that before in my videos
You
where
have.
I have in my meditation videos at the end, I gave them a little blast of healing energy, and because it doesn't hurt the eyes or anything like that. So
Well, supposedly, they say it can have an effect on the eye.
I
It
mean,
does.
I wouldn't
It
shine it
doesn't.
in someone's eyes, but
Oh,
I'll shine it at my camera.
well,
That's not
I
gonna
have a friend,
heal.
an ophthalmologist, who bought 2 of them. And as I dropped them off, I told him, don't shine it in the eye. The FDA says you can't shine it in the eye. Although this has weak power. That's how it's so inexpensive,
Yeah.
because you don't need the power. You're not penetrating the tissue. You're relying on the biofield to take the information into the tissue. So you're not penetrating it. So he says, why? He says, I use lasers on the eye all the time, high-powered lasers. And he was right. A good way of using it on the eye is taking like a cotton ball and wetting it, and then treating that and putting it on like a poultice over the eye.
Oh,
And I have done that, and I've seen someone who could not open their eye, like it was all pussy.
yep.
And the person was on antibiotics and had been on antibiotics for a couple of days at the time. Happened to be a friend that I ran into
Mhm.
who happened to have one of my lasers. And I said to a female attorney, And I said, why don't you try the laser? She said, well, you can't shine it in the eye. I says, but you can take it and it just came to me, take water and laser it and put it on. Within 10 minutes, she was able to open her eye.
Wow.
That's the kind of, I mean, you can just use your head and experiment. I mean,
Yeah.
that's
It's
how you find
endless.
out what it does.
It's really endless what you can do
It
with
is. It is. It really is, because it'll work on anything that has an inflammatory component. Most pain has an inflammatory component, and
yes.
most illness has a. I had the lady that I told you about from Austria.
Mm-hmm.
She sent me, probably most people don't follow up after they buy it and don't give you feedback
Yeah.
unless I know someone personally. She sent me a information on a number of different things. We don't have time to go into it now, but she had a friend who she didn't know the diagnosis, but she told me what his symptoms were, and it was ulcerative colitis. And I said it sounded like that, and that's what it turned out to be.
Yeah.
She said, would that help? And I says, I have no idea. I've never had any feedback on ulcerative colitis, and I don't know anybody as far as treating ulcerative colitis.
Yeah.
He bought one. And initially, he wasn't doing well. I happened to communicate with her. He didn't have the means to communicate over the internet, but she did. And she says, well, so far he hasn't responded well. And I said, how is he using it? And she told me, I said, I don't think he has a serious problem. He has to use it like you would take medication. I suggest having him treat himself for 15 to 20 minutes, 3 to 4 times a day. Make sure he uses the laser in everything that he eats and drinks, okay? Subsequently, that individual was able, she saw him, he came and made a visit. All of his pain disappeared.
Wow.
He had no pain whatsoever. He was eating foods he said he hadn't eaten in years, and he gained his weight back. And I just got a note from her. This is now probably 3 years later. He's still fine.
Wow.
Yeah.
And does he still use this?
He's still using it. I don't know if he has symptoms of it now, but he obviously is still using it. Yeah.
Well, healthy or sick. I mean, it can't hurt to use it. So why not use it, whether you're
Well,
healthy or sick?
no, you should use it for a number of reasons.
That's
Okay.
what I mean. Use it all the time, even if
One
you're
of
not
one,
suffering from
one
something.
of the main reasons, if you look on you've seen the blood study,
Yes, 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 yes,
the
yes, yes, yes.
rouleau formation. Okay. The body only has certain ways to react. So, and one of the tests that is very commonly done is a sedimentation rate, which is a non-specific test that tells you whether you have something going on, whether there's infection or inflammation in your body. A
Mhm.
person who has cancer will have an elevated sed rate. A person who has an infection will have an elevated sedimentation rate.
Yeah.
Okay, rouleau formation is a clumping of the red blood cells. It's like if you would see petals, rose petals floating in a pool. Individual rose petals would be the way that our blood cells should look in the plasma. You'll see each individual cell, not clumped together in a ball. When you're exposed to things that are detrimental to the body, like high tension wires, radar ranges, Wi-Fi, high doses of sugar, your body will develop a rouleau formation. Now, the study that I did on my website, I put a glass of water in a radar range in a microwave oven,
Mhm.
and I think I left it on for 20 seconds. That puts the negative energy of the microwave into the water. I had the individual drink half the glass, and we immediately took his blood, put it on a microscope, and you can see the clumping of the blood cells. Then we took the laser, had him actually laser the water, okay, for just a few seconds, okay, took his blood again and drink the rest of the water, same water that caused it. Drink that water, took the blood's perfect. You can see that was done in real time.
Mm-hmm.
Now,
That's
if you take a person who has a cigarette, they're hooked on cigarettes. A cigarette smoker, after smoking, will show you a rouleau formation from the smoking of the cigarette. Okay. If you laser the cigarette before they smoke it, they won't develop it. It'll stop it. So my point is that everyone in today's world, we're all exposed to these forces and we don't see them. Okay, they're talking about the EMF fields. they're a real threat, and you're going to see more and more people coming down with symptoms secondary to the EMF fields.
Hmm. Absolutely. My,
So,
sorry,
okay,
go
my point is that will cause the rouleau formation. So that's why
ahead. Mhm.
put it in your water, put it on your food, because you're protecting yourself throughout the day. That's
Mhm.
why. Okay.
I think that that is so unbelievably important right now because did you know that they actually have 7G already
No,
um,
I didn't know
created
that.
and waiting in the works? Yeah.
I can imagine 5G is bad enough.
Yeah,
I mean,
exactly.
it's technologically. I mean, it's great. I mean, if you want to download a movie in 3 seconds, but we don't know the ramifications of long term. That's the problem. That was the problem coming out with the vaccine. You can come out with a vaccine, super fast, but
Yeah.
you can't test it super fast. It takes a certain amount of time. And in the past, I don't care how it's made, the vaccine still takes 7 to 10 years to test.
Yes. Yes.
Has to be tested in human beings. And it was tested in human beings. We were the rats. We were the lab animals. Okay.
People have to remember that it was still an experiment right up until March of 2023, March of this year. So
That's
all
right.
the ones that were taken before March of 2023 were actually part of that live ongoing experiment. So
Well, the FDA originally, the FDA said it was going to take until December of this year
yes,
to clear it. Okay. To clear it. That's then they would have the seal of approval.
yeah,
Okay. That was fast. That was fast tracking it. Now, our president, Biden, couldn't, he needed a little bit of force to force people to take it. And he could force the soldiers, he could force the public employees. And so by September of last year, it was approved. And I had told people earlier, if that occurs, then it's a hoax. And sure enough, they approved it by September, and it wasn't supposed to be until, in their own words, December of 2023 was the earliest it was going to be approved. So, I mean, there's so many things that are just, they
oh,
call Robert Kennedy right now is running for president. I'm sure you know that
yes,
in the States.
yes, yes.
And if you see the newspapers, he's an anti-vaxxer, he's not credible, he's not this, he's not that. He's the only one that's been out there telling the truth.
I know.
All of the disinformation purveyors are telling you the truth. And what they tell you is the truth is not the truth. Just the opposite.
I 1000% agree with you. But it's for the people who have the eyes to see, because I think that each and every one of us are playing a role in this charade right now, in this, whatever you want to call it, simulation almost.
Yes,
You know, I'm a character in your play just as much as you're a character in my play or my story.
you're
And
right.
so I think each person has to do what is according to them, because of the world of duality that we live in. And so I think that there are certain people that feel that they were called to do that, or felt like they had to do it. So to me, it's not what's right or wrong or anything like that. It's you do you. For me, it's just the freedom to choose,
Yeah,
and for people to be educated about what's going inside of their body, because if they do choose to go down that route, because Leonard, there was even pastors and stuff that were saying, "Oh, God is telling me to get it," and I'm like, "Really? That's the download that you're getting from our Creator, to put something so sinister inside of your body?" But I didn't argue. Teach their own truth, right? But it's the right to choose. That's the biggest
I,
thing. And
I
just
agree
pray
with
we're not
you.
faced with that
I
again.
agree with you 1,000%. People should have the right. And when they took individuals, I mean, I was so aggravated. The first responders who worked for a year without any protection, supposedly, okay, and didn't have the shot around, and they were taking care of people.
Mhm.
All of a sudden, they had to take the shot in order to keep their jobs. They were fired.
Yeah.
They were fired. And the kids that had to take the shot to go back to school, to finish, to graduate, okay, college. I mean, that's criminal, absolutely criminal.
I agree with you.
Kind of stuff that we were doing. It's people have to wake up. And the thing with the masks, the same thing. The mask. If you really go in and study masks, as a surgeon, we wear masks to protect the open wound on a patient, okay? You don't have to mask people who are well. You mask a person who was coughing and who was sick. But even then, that doesn't stop. It stops the large droplets, but that virus doesn't even see the mask, doesn't even see it. And Fauci knew this, and anybody who knows anything about masks know it. And, you know, and yet I see doctors out and about, outside, wearing masks. I mean, they don't use their heads. They're completely they're like sheep.
Yeah.
Just
Yeah, I agree. But it's funny, it went through my head the other day. The only people that are still wearing masks are the ones that have, you know, had their 4 series of shots.
well,
Because the unvaccinated sure aren't wearing them.
if you look, Patricia, the people who are coming down with COVID are the ones who've had their shots and boosters.
Yes.
They're
Yeah.
the ones that are coming down.
Well,
And
that's what they're saying about this heiress thing too, is that it's going to be more of the vaccinated people that are going to get that because their immune systems have been wiped out. But the problem is so much of the population now has had it that it will look like a pandemic. It will look like, oh my God, people are dropping dead from it. Yeah, but they're dropping dead from the vaccine, not from the virus. Do you know?
right. No, you're 100% right. Unfortunately, that is the case. People have to wake up. I keep telling the people, my friends who've been vaccinated, please don't take any more.
Yes.
Don't take any more.
Yeah. Yeah.
And my family, I mean, even my own family. You know, one of the largest purveyors of, quote, disinformation is Steve Kirsch in the United States. Okay. He started the foundation. In fact, he's been exposing. This fellow was a very wealthy individual. He was a medical philanthropist prior to this. He made his money in high tech in Silicon Valley, and he took the 2 shots, I believe. I don't know if he had a booster or not, as did his family. And then he started seeing people that he knew and getting reports of family and friends and so forth who were getting ill. And he started looking into it. And he's very, very good with numbers. And he saw that we've been led down the wrong path. And he is probably right now the top guy in the world speaking out against the vaccine.
Wow.
Yeah.
You know, and it's tough. It's tough because I'm even worried about this video. You know, we'll see how long it can stay up for. But I think that people really need to be speaking their truth, standing in their truth. And at the end of the day, I really hope that there has been enough people that have either, you know, had a side effect, know someone who had a side effect, that they're going, no, I'm not doing this a second or third time around, you know, and come to that conclusion themselves, because we can't force our views on anybody. We can just put it out there for other people to hear and come to their own conclusion.
But in Canada, I mean, Canada was even worse than most places, and Australia. Yeah.
Well, and even right now, all of our news is censored. There's this new bill that came in that now there is no Canadian media on any like platforms like Instagram, Facebook, none of that. It's all been censored. So yeah, and I mean, we can go to the news source, go straight onto their website or turn on the TV. But again, that's all government funded stuff. He's literally shutting down the little guys that are the independent truth speakers. So it's really sad what's going on up here. We're not
No,
here.
it really is. It really is.
Yeah. But we're here to change this world. We are here to be able to plant seeds and hopefully, you know, let them bloom wherever they need to.
I agree with
you. Dr. Knell, thank you so much for joining me here today. And I love that we could speak our truth together. I know that you and I are definitely on the same page. Before we go, where can people get a LifeShield laser from?
Online, it's on the website, www.lifeshieldlaser.com.
Perfect. And yes, I totally recommend this product. I've had a LifeShield laser now for what, at least a year. I've had this for.
I think it's more than, I think it may be more more than
Yeah.
that girl that you called me about, the girl you treated at the campsite, at your camp.
Yes,
Uh,
yes, that's right. Oh my God, Wendy, Wendy. I'll tell you guys this really quick before we go. So my girlfriend tripped, and it looked like she sprained her ankle, and her whole foot, and calf and everything was right swollen, really bad. And so I didn't have Tylenol or anything that I could even offer her, but I had my trusty laser in my purse. So we did the laser up and down her leg. And within, I would say, maybe 5 minutes, 7 minutes, the swelling was gone. We literally watched the swelling go down on her leg. So yeah, that was pretty amazing. Thank you for reminding me of that. I forgot
I
about
remember
that.
that because you called me about that.
Yeah, I was really impressed. We all were because we all watched it, right? So yeah, it was really amazing. So definitely www.lifeshieldlaser.com. And yeah, thank you so much, Dr. Knell, for joining me here today
Thank
with
you.
your wonderful wisdom. And thank you, everybody, for watching on my YouTube channel. If you haven't subscribed, definitely click the subscribe button. And if you're looking for information on me and my classes or what I have to offer, it's www.patriciamona.com. Thanks so much and have a wonderful day.
Thank you, Pat. You're a ray of sunshine. You really are. You look like you look like the sun.
Thank you.